This film presents two patients who underwent mitral valve repairs using the Memo 3D annuloplasty ring. The first patient underwent repair of a large posterior leaflet prolapse. This was a symptomatic 71-year-old woman with severe mitral insufficiency. Pre-bypass echo showed a large anteriorly directed jet and prolapse of the P2 segment of the posterior leaflet. This is seen particularly well on 3D echo imaging. Direct inspection of the valve confirmed a 2 cm long, severely billowing P2 scallop with thin, elongated chordae. A quadrangular resection of the P2 scallop was carried out with vertical reduction annuloplasty of the posterior annulus and placement of a 30 mm Memo 3D semi-rigid ring. Post-bypass imaging showed no residual insufficiency or SAM. 3D echo was able to capture the motion of the annuloplasty ring relative to the cardiac cycle. Expansion and contraction of the AP diameter of the ring was noted. Conformance of the ring to the saddle shape of the annulus was also present. Simultaneous cross-sectional 2D imaging also shows flexible movement of the ring. The second patient underwent a redo mitral valve reconstruction after a previous failed minimally invasive procedure 18 months earlier. At the first operation, this 50-year-old man had undergone a quadrangular resection of P2 and placement of a 28 mm flexible partial annuloplasty ring. He developed recurrent severe mitral insufficiency and left ventricular enlargement. Representative still frames show primarily a large centrally directed jet of mitral insufficiency. Direct inspection of the valve disclosed that the original ring was slightly rotated and not attached at the right trigone. There was restriction and inadequate height of the reconstructed posterior leaflet. The previous ring was removed and the posterior leaflet enlarged with a patch to give a greater coaptation surface to the leaflets. A larger 30 mm Memo 3D ring was placed and a cleft found at saline testing closed. Post-bypass imaging showed no residual insufficiency or SAM. Coaptation of the anterior and posterior leaflets is now satisfactory. Expansion and contraction of the AP diameter of the ring is seen well in cross-section. Again, normal movement of the annuloplasty ring with the cardiac cycle is seen when the entire ring is brought into view by three-dimensional imaging. In summary, post-implant imaging in these two patients demonstrates the flexibility and conformability of the Memo 3D annuloplasty ring. The ability of the ring to assume the saddle shape of the annulus, to bend in and out of the plane of the annulus, and to change its antero-posterior length all contribute to annular area changes during the cardiac cycle.